Okay, today's our guest is Dr. Harish. He has 21 years of experience. He is a JCI trainer and he's running a clinic in Kalamasheri, Harish Homeopathy, and Kurumasheri, Cochin. I'm welcoming him to our webinar. Please wait, let me check whether.
Our guest will be joining within short 2 minutes. Yeah. Dr. Rajini, you can.
Yes, doctor. I have already informed them, I think. Up to that, we'll talk. Actually, today's class was about migraine. Dr. Ram Parvesh, sir, you can talk about your experiences about migraine. Hindi class was about migraine. And Dr. Danish also will talk about some.
Thank you, Dr. Ranjini. Dr.
Yes, we have already attended about migraine and its treatment. Actually, she couldn't complete the class, even though you can share your experience up to the guest comes.
Dr. Jahar, migraine, of medicine, migraine.
It's not clear, sir. Your voice is not clear. Okay. Maybe the mobile is away from you.
Mobile joined in a speaker. Voice clear?
Yes. Now it's clear.
Dr. Chahar deals Anshul Shah Chahar migraines in Hindi session. Migraine is homeopathic way of treatment, easily treatment of migraine. Many cases treat the migraine, natramur, Irish verb. Irish verb is a very good remedy, migraine, asphagia, aspergillia, sagnaria. The Irish verb, 2 to 3% bills Irish verb and natramur. Migraine, aura, suffer aura. So migraine homeopathic easily treatment migraine. Other pathic treatment is a very difficult migraine. Homeopathic treatment is easily way of treatment and curative way of treatment migraine. So very nice presentation, Dr. Anshul Chahar.
Hello.
Thank you, doctor. Thank you.
Thank you.
And Dr. Danish, what about our guest? I think, Dr. Danish, have you talked to him?
Guest is trying to
Yeah,
join.
join now. Our guest is joining.
You can wish, you can eat. Happy Eid to all.
Happy Eid to all. Thank you.
Yes. Doctor has become the co-host.
Yeah, I made him as a co-host. Dr. Harish, please welcome. You can start now. I have already introduced you and we were waiting for you.
You can make a simple introduction so that we can begin from there while uploading.
Yeah.
Okay.
Dr. Harish is having 21 years of experience. He's a JCI trainer and he's running clinic successfully in Kalamasheri and Kurumasheri in Cochin. Now he's sharing some of his clinical experience. Doctor, please welcome. You can, if you have slides, you can share it.
I think I have been made a co-host, right?
Yeah, you are co-host.
So once again, I thank. I think this is the 1386th day. Okay, right. So it's great to be here again. So I think audio is okay.
Some echo is coming.
Yeah, maybe you have opened two system, right? Only one? I don't know what.
Just give me a second. Is it okay now?
Yeah.
Yes,
Okay.
yes.
Okay, right. So actually, we have lost at least 10 minutes time. So I am going straight into the content. As we already said, it is all about discussing some of the cases, and it's all common cases. Basically, my intention of sharing any of the cases is basically to not to prove, but to reinstate that we don't need magical medicines or magical concepts. It's all about keeping things simple. Homeopathy is very simple. Of course, it has its own challenges, but basically the principle is simple, and the method of application of the principles are also very simple. The only thing is that you need not complicate things, and that is the only thing that I want to reinstate. So, keeping the things simple will help you to understand the real rubrics and to what do you call it, to prescribe the medicines and to follow up according to the principles that has already written down. So there is no need for going for magical medicines or magical prescriptions or magical interpretations. So that is the only concept that I am telling. So I will be discussing only the very routine cases that we usually see. Okay, so let's go to the sessions. Just guide me whether it is being shared correctly. Okay. Okay, is it okay? Visible? Yeah. Okay. Right. So I said it's all some of my clinical experiences. Maybe 5 or 6 cases we will discuss today. Actually, I'm sorry for the very bad shape I am presenting before you because I have a bad throat and that maybe I feel a bit feverish. So please pardon about my appearance and all that. Okay, thank you. Okay. This is a case of chronic allergic cough. Actually, the symptoms I have already described. Just you may read through along with me. A 44-year-old female presented with cough since few days. It started in December 2023. She reported me in February 2024. Advised to do IgE, which was 492, and IgE means immunoglobulin E, and absolute eosinophil count was 690. Actually, if you see any of the allergic cases, it may be eczema or sneezing or allergic cough or anything, I usually do these two tests mandatorily: IgE, immunoglobulin E, and absolute eosinophil count. Cough aggravated by lying down. I prescribed HIMS 200 with no major changes because she came on a busy day, so I just prescribed with that symptom aggravation of cough on lying down. So it didn't give any result. She reported me after 1 week, and on 10th 2024, February 2024, with severe cough on talking and ascending stairs, involuntary urination on coughing, rattling in chest on auscultation, expectoration gives her cough a bit relief, and warm drinks ameliorated. So I just repeated and I gave ourselves 30 plus zinc for 3 days. And she was she was a patient. She was been under my treatment for hemorrhoids and all that for many years. So, intermittently, if she has any complaints, she will come to me. So she was a patient which we had acquaintance for many years. And she didn't came to my clinic for 4 months. And she reported at my clinic last week on 10th of June. And she said that last medicine, that means assault 30 didn't work, and her cough was aggravated. She took 5 courses of antibiotic during these last 4 months intermittently, and many Ayurvedic cough syrup, all giving very transient relief only. It may give some relief for some days only. And she could not sleep well for last 6 months. Almost for last 6 months, she was had a very disturbed sleep. I examined the case again, and cough was tickling type. Actually, it is tickling in the throat. That is the sensation, she said. It was dry type of cough, and the marked aggravation was at night. And on observing, I could notice that there is an inspirational whoop. Like her cough was on the day she reported on 10th of June, it was like this. I couldn't record it. This is an inspirational move, and incidentally I had actually my friend Dr. Vineet, some of you may be knowing, he also presented a case with very similar inspirational move type of cough where the patient coughed like this. This was expressed by, and he also discussed the case, and that was in my mind when I was hearing this inspirational move. Okay, so I gave the medicine for the inspirational move. Actually, Dr. Vinod has told me that Drosera is giving a good result, and cough aggravation at night is naturally a symptom which goes with very well with Drosera. So I gave Drosera 200 three pills three times for 3 days only, and along with other placebos. Okay, and after that. Okay, I think I'll just can you hear? I will play a video or audio. If you cannot hear it, please tell me. Okay.
No, doctor, we cannot hear anything. Yeah, now it's good.
This was I hope you heard it, right?
Yes.
So
Okay.
on 12th of June, after 2 days, she reported me with this. Actually, not reported. She called me and put WhatsApp of this voice. And on 12th 6 2025, about cough pattern was shared to me. Patient said she was feeling aggravated, but on observation, the inspirational whoop is gone. If you hear this cough, you can see that inspirational whoop has come down drastically. And I checked with her, and she said she's not having that difficulty. Upon probing further, she said she slept well for last 2 nights, which was deprived for the last 6 months. Actually, she was improving, and the point is that we have to see these points, right? See, when a patient is suffering for 6 months like this, patient may not observe the other aspects. They will be focused and obsessed with the particular symptom only. So we have to check when we give a medicine. We have to check whether there is an improvement in the general aspect. When if there is a genuine improvement in physical journals, then you can wait. And after now it is after 5 days. Now she has absolutely relieved of cough, and she is absolutely okay. So the point is, if you miss that point, that she is better with her inspirational woof has come down, and the major physical general that her sleep, which was deprived for 6 months, has been changed, and she could sleep well after taking Drosera for the next 2 nights is a very important factor. So whenever patient may focus only on the symptoms, you have to probe this area, especially when it is only maybe 24 to 48 hours of time after giving your prescription. That because it may take a few days to get the real improvement at times. Okay, at times. Not always. Many a times you will get immediately improvement. That is one thing. But in such cases, especially allergic cases, You may get the real improvement after maybe 2 or 3 days. So you have to see that general C is improving or not. That is very, very important. That is the point I have to say in this case. Very simple case, straight case. But actually, believe me or not, she has suffered for 6 months, took 5 courses of antibiotics, n number of cough syrup, but at last it was improved with Tusigra. Okay, right. It is all about getting that key point. That is all what is needed. Okay, right. The second case, a case of eczema. A 7-year-old girl came to me with dry blackish eruptions, especially on fingers across both legs and inner thighs. Especially more was on the right leg, and I will show the photos of the right leg only. So severe itching, especially in the morning, started a few months back. On checking IgE, it was 3,470 and absolute eosinophil count of 575. So 3,470 is actually it is a high level because normal value is around 150 to 200. So personally, I have seen a case of 18,000. So this is not a big value as compared to that, but still 3,470 is an increased value. She had great desire for chicken, ice creams, prawns, and fruits. Aversion to vegetables. Her sleep is good. Heat tolerance is less. And stool and urine were normal, but sweat has been increased. She is fearful of being alone and of darkness, and her mother had a fright during pregnancy. This is the history that she presented. Okay, so let's see what are the symptoms that I have taken. You all can guess. Maybe for 1 minute, you can all guess what are the symptoms. Very straight away symptoms. These are cases which you may take from any part of the world and you will get the same medicine. These are all very, very straight symptoms, very directly indicating. No interpretations, just straightly apply. Okay. So these are the rubrics: skin eruptions, eczema, skin eruptions, dry, general food and drinks, chicken desire, food and drinks, food desire, food and drinks, ice cream desire, general heat sensation of. These are the rubrics. Actually, I didn't actually. I just kept the mental symptoms as PDF, and I focused only on the physical general. So let's see what are the symptoms coming up. Phosphorus, sulfur, natrimor, and alchemra are coming up. Of course, the patient is hot to a certain extent. I will not say it is out and out hot, but it is more towards hot. But the two symptoms, actually three symptoms. One symptom I had written in the script. The two symptoms: fear of being alone and fear of night, are directly indicating phosphorus. And she was a very extrovert, not at all introvert or domineering like Natrimor or Dalcamera. So it was all a fight between phosphorus and sulfur. But I had a gut instinct and I went with phosphorus. Okay. Phosphorus 0/1, first cup, 1 spoon, 1 hourly was given. I hope you will understand what first cup is all about. So 1 spoon, 1 hourly, I repeated. And you can see the pictures. Day 1, day 2, no, day, excuse me, day 5, day 10, day 15. So I felt that it was not that much improving, but her pain and the itching has been come down to a bit, but it was not improving just as I expected. So I thought I had to intervene and I gave phosphorus 0/2. First cup, 1 spoon, 1 hourly. And on the 15th day, I gave phosphorus 0/2. On 20th day, you can see the changes. In between, actually, honestly, I thought about giving graphitis because graphitis is a case where you can give in cases where eczema with blackish discoloration. But I just wanted to hold on and I to try the other potencies of phosphorus. So phosphorus 0/2 on 15th day. On day 20, it was improving genuinely because there are some spot of wetness, but definitely the center to surface recovery can be seen. On day 27, this is like it. And She has improved. Actually, last day she came to me, but I forgot to take the picture because it was almost all gone. So this is the improvement that I got. I think I should give credit to zero bar potency because I had a used centesimal or decimal potency for this case, it would have been gone. And because I could repeat as many times as possible because only because I gave the zero bar LM potencies. Okay, so LM potencies are very it is useful in many cases. No, but we have a what do you call? We have a notion that it is useful for only for this sort of skin diseases, but it is useful for any disease. But definitely skin diseases where there is possible of high aggravations, this is very useful. This is one classical example which will vouch for that. Okay. Third case, a case of mumps and a post-mumps cough. A 35-year-old female who was getting cured of her painful cracks of both legs under our treatment. Actually, she was a patient, a chronic patient for what do you call cracks in her legs, both not legs, on the both the soles and the heel, and it was improving very well with melandrinum in a beautiful manner. In between, she had an attack of mumps, and she called over phone and informed that she was down with mumps and had fever and painful swelling under the ears and chin. She took paracetamol for fever and fever came down, but pain and swelling is increasing. I asked her to send a picture. And this is the picture she sent on March 9, 2024, this year. This is the picture on both ears and below the chin. You can see the swelling, and there is a redness that is not appreciated in this picture. And there was severe pain also. And I didn't take a detailed case, I will honestly tell. I just considered the symptom mumps, and her basic nature is very mild, and she is hot in nature. So I went with the very classical medicine, very not classical, very age-old medicine that we use for this. Pulsatilla 0/1, first cup, 1 spoon, 1 hourly was given. The very next day, you can see the change. On March 10, 2024, you can see the changes. There is marked change, and symptomatically her pain relieved, no pain, size reduced appreciably, and there was no redness. So I continued Pulsatilla 0/1, first cup, 1 spoon, 3 hourly. From 1 hourly, I made it to 3 hourly. This was all on the second day. Okay, so March 9, this is March 10. And on March 15th, after 5 days and after 6 days of the Pulsatilla, you can see she is normal. Sorry for not covering her eyes. Okay. So no pain, swelling, or redness, and I gave placebo only. Okay. And surprisingly, post mumps, in the second week of April 2024, she reported to me with severe chronic cough since 3 weeks post mumps recovery. Dry tickling cough started after traveling in an AC car for 4 hours. And during night, cough becomes so severe that she has not slept for 3 weeks. So this is the symptom that she came to my clinic, and I checked, examined, and it was only a dry tickling cough only. There is absolutely, her chest was very clear, but she was unable to sleep for 3 nights, even daytime or nighttime. It doesn't matter. She couldn't sleep, especially night. The cough gets so severe that she cannot. She was not at all able to sleep. So I first thought of giving, taking the case and repertorizing, but I just tried to give Pulsatilla. I wanted to continue with Pulsatilla because there is, yeah, no, actually, no, sorry. Actually, I repertorized the case. Cough night, cough chronic, cough dry, cough tickling, throating, and sleeplessness cough problem. And the rubrics you can see: Pulsatilla, phosphorus, sulfur, causticum, lycopodium, ammonium murium, and spongium. I thought of spongy actually, but as I could get a good result with Pulsatilla for the mumps, I just wanted to try the Pulsatilla once again, and I gave Pulsatilla in 200 potency, 1 dose in 100 ml water, 1 spoon 2 hourly. And the very next morning, she rang me and thanked me, and I asked what happened. She replied that I have reminded her the real value of sleep. She said she could sleep well for the first time in the last 21 days. Cough was negligible, and she asked, actually, literally, she asked what magic I did. So I just replied that it's called homeopathy. So that is something that you get. See, it is simple, but if you cannot sleep for at least 2 to 3 days, you know what will be the condition. So a person who didn't sleep for 21 days, and actually her mother-in-law also said, "What the heck? Why didn't you go to this doctor for last 21 days? You were treated with, you were cured with your mumps with him. So why you waited for 21 days?" But these are something that you cannot explain, right? She said that she just went to the doctor, allopathy doctor for some other reason, and he gave her medicine. So she waited for the result of that medicine, and it just went on for 21 days. And at last she came, and it was only a matter of 24 hours to cure that. Okay, so that is, this magic is called simple magic homeopathy. Okay, and that also, see the rubrics. These are all very simple, straight rubrics. Aggravation night, chronic, dry. These are the particulars that I used because I just wanted to focus on that, because there was no other, maybe exposure to cold climate, as the travel in the AC is the only one triggering factor. Actually, I think the pulse level will cover that also. Okay, and the only general rubric that I took was general sleeplessness, cough prompt. Okay. Right. This is another case of a young lady, 18 years old. She was suffering from uh, allergic urticaria. And allergic urticaria was, it was in such a severe state that she was suffering for last 10 years, because she, from the age of 8, when she was studying in maybe third or fourth standard, she was suffering. And she couldn't eat prawns, crabs, pulses, potato, all she likes, but she cannot can have, because it all creates severe aggravation. And even without these medicines, this food, without prawns, crabs, pulses, and potato, without no evident triggers, she can have allergic urticaria. That is the biggest problem she was suffering. She had a great craving for salty snacks, stool once in 2 days, and that also Leandric stools, undigested food materials in the stool. Chilly patient, sleeps on abdomen, offensive sweat. And as she was suffering for 10 years, she was very desperate, because she didn't believe. It's only because it was like she has to do something. That's why she came to the treatment. There was no belief in any of the system, not just about homeopathy, because she was fed up and took the case. These are very straight symptoms. Just observe. I gave with the very basic rubrics only I selected. Direct mind, despair, recovery of sleep position, abdomen, skin eruptions, urticaria, food and drinks, salt, desire, and as she was towards chilly, I took general heat, lack of vitamin. Calcarean, atramor, phosphorus, and costigan came. All the medicines covered very well. And for no further explanation or interpretation or reasons, I just gave calcaria because it came first. That's it. Calcaria carb 200, 3 pills, 2 times for 5 days. And since this day, I think she, actually, I didn't mention the date. I think she came to me at least 3 months back. At least 3 months back, she came for the last consultation day before. And since last 3.5 months, she has not had any attack of urticaria. And she took egg, potato. She didn't take prawns or what do you call crabs, but she took pulses, potato, and what do you call eggs and all that. And she has not had any aggravations since then. And I'm waiting. Maybe I have only given this calculator up 200 for this 5 days only. I'm waiting. Maybe down the line, after maybe 1 or 2 months or 3 months, I will slowly introduce prawns. Let's see how she responds to that. Because my point is, in an allergic case, if you want to say it is a cured case, you have to consider 2 things. One, if she has an increased level of IgE or absolute eosinophil count or any allergic value, if it is increased, it has to come down. That is point number 1. It has to be a normal. Then only you can claim it as a cure. Second thing, you have to introduce those food items or introduce them to those conditions which usually triggers them. And if she can or he can tolerate that, then only you can claim it as a cure. Otherwise, only you manage it very well. That's it. You and allopathy doctor are similar on similar lines, but definitely we are doing much better job. That is one thing. But still, you can only claim that it is a well managed case. So this is so far is a well managed case. I am waiting whether it is going to be a cured case or not. Let's see. A case of migraine. Actually, I was not very well for last 2 days, so I couldn't complete the module. So I will explain the case not through our PowerPoint. I will just explain. Okay. Yeah, migraine. Kartika Ajay. It's a 34-year-old lady, migraine since 7 years, but it has aggravated for the last 3 months. Continuously for last 3 months, she is having headache for every day. Headache must stoop the neck. The position she has to stoop. She has to keep her head like this. It's not about just closing the eyes. She has to keep the neck down. And looking up will create severe aggravation of the pain. Keeping the head straight also gives severe aggravation. Their whole head is paining. Nausea, headache with and she has the classical symptoms of migraine like aggravation from traveling, aggravation from sun, aggravation from noise, aggravation from light, and all that. And strikingly, she has a relief with sweets. Usually, we see aggravation of migraine or headaches with sweets, but she had relief with sweets. You are eating something. Eating pain relieving with eating is usually you see with the migraines. Amelioration by closing eyes. Excuse me. And her appetite was normal. This was good. Stool, sweat, and urine, all that all are normal. She is towards a hot patient in a slight degree only. She sleeps well on back, and she has specific desire for sour food. These are the symptoms that I took. And the rubrics are head pain accompanied by nausea, head pain closing the eyes amelioration, head pain looking upward from sleep position back on, food and drinks, sour food desire. These are the rubrics I took. And actually, the medicines coming are sulfur, calcarea, ignition, and aconite. But if I had posted the photograph of that patient, you would definitely prescribe it immediately. She was actually the physical constitution or the facial expression. These are the two things that you should always check. With experience, you will understand the importance of those things. Physical constitution and the facial expression. This patient was anxious on her face. Delicacy is there, but bold demeanor is there, and a hysterical sensitivity was there in her eyes. I cannot tell it how, I cannot explain it, but you can easily judge a person if you see her judge a person, hysterical person from her eyes. I think any good homeopathic doctor who has good observation skills will easily understand that fragility in the eyes, especially of the hysterical ladies. But I could sense that. So I went with ignition. That is the only reason. Because otherwise I could have gone with sulfur, because sulfur is the hot remedy among these four. But I went to ignitia because only of that observation. Okay. And I gave ignitia 200. The date of her consultation. Yeah. 22nd. Yeah, 2 months back she came to me for the first time. And since ignitia 200, 1 by 100 ml aqua, 1 spoon TDS for 3 days. She didn't report any migraine after that. After that, she had travels. She had exposure to sun, exposure to rain. All that happened in the last 2 weeks. Sorry, 2 months, and she hasn't reported any case of migraine headaches after that. So, again, we will not say it is a cure because 2 months is a too less of time. But the point I want to tell is that take simple direct symptoms, which is undebatable symptoms, and see the PDF is very, very important. How you differentiate is very important there from this. So sometimes it may be a physical constitution, it may be a facial expression, it may be a physical general, it may be a mental general. That all can be used as a PDF. Okay. Luckily, in all these cases, it has worked. At times, it may not work, but in that case, you will have to redo the exercise. That's all. Okay. And I think this is another last case. It is a case of acute ear pain. This case came today morning only. He is a very jubilant and happy-go-lucky, very, very exciting personality. I know her for last maybe, she's 18 now. Maybe for last 15 years, I know. She said from the childhood she usually come to me. And today morning, she was a totally different person. She was like literally crying. She was not weeping actually. It was not weeping. It was like uh, tears were running down her cheeks with severe pain. And her hands, her legs were all, she was really restless. She usually talks a lot, but today she didn't talk any bit. She was just restless. She just, from the body language, it was all about don't ask too much, please give me the remedy. That was the attitude of that today. So I took those rubric lacrimation pains from, restlessness pains from, pain ear, it was on the right side, so pain ear right. Yeah, restlessness pain from, eye lacrimation pain right, pain stitching, that is was the sensation, and pain inside the ear, so pain meatus. These are the 5 rubrics I took. She came to me at 9:35 in the morning. I gave Belladonna 1 dose and asked her to wait. And 9:40, after 5 minutes, I checked, no change in the pain. So I went to the second medicine, Aconite. Aconite 200, 1 dose was given at 9:40. And after 9:45, when I checked, she was talking to me. She was expressing her symptoms. She said there is a bit of improvement. That blocked sensation has come down. A bit, she said maybe 10 to 20% has reduced. That's all, but still I can bear it now. And that lacrimation has stopped by that time. So, and she could express her symptoms. That is the key. So, in 5 minutes, that is the change I received. So, I took 100 ml of aqua and dropped 2 drops of Aconite 200 and gave 2 percussions and asked her to take it every half spoon of medicine every 15 minutes. And I gave Aconite and Merxol as SOS. And in the afternoon, at by 4 o'clock, her mother called me. She is sleeping very well. She has not reported any pain. She took food also, and she is no fever is there, restlessness is not there, no lacrimation. She woke up by around 4 o'clock and had food, and she again slept out after 5 o'clock. So that is the report I got at 6 p.m. in this evening. So the speed, the thing is that usually we are blamed for slow way of treating disease. Like people think that we take years to cure a disease, but when the disease is fast, our recovery is also fast. So this is a classical example, and always, especially if there are youngsters in this web group, please, if there is an acute condition coming, you give the medicine and ask them to wait for 5 or 10 minutes and check after 5 or 10 minutes, so that you are giving a message to them that homeopathy is fast, and if the remedy is right, you will get the result within just like that. Okay, that is a message that you underline, you are giving subconsciously to them. And if the medicine is right, definitely they will have the confidence, and you can repeat the medicine according to the situation. That is another thing. Okay. So giving that relief from the clinic itself, even you need not want to have that IP facility in your clinic. You can have just request them to wait there. That's it. So that is something that you can do. These sort of things are also important because these gestures, body language, the attitude, all will give that confidence in your patient to trust you. Okay, so that is why I took this case. Otherwise, there is nothing exciting in this case. But I just wanted you to give that message. Okay, right. Okay, right. So I wanted to explain another one or two cases, but my health was not good enough, so I couldn't prepare the slides very well early enough. So please accept my apologies. But definitely, thank you thank you for the invitation once again. I'm happy to be here in this web room. Maybe this is my 15th or 20th class, I think. I don't know exactly, but definitely thank you, Darius Doctor, and the entire team of IFPH for this. So thank you once again, and over to the moderator. Thank you.
Thank you, Dr. Harish. And we have some more minutes for discussion. So, doctors, please raise your hand and ask question to Dr. Harish. Doctors, please. I think while during the class time, someone has raised the hand. I don't know who is that.
Maybe my mistake or
You can ask now. Dr. Ahmed? Doctor, you can unmute yourself. I was sending you the permission to unmute Dr. Ahmed.
I think he has given the appreciation.
Just I am sending my call. Thank you very much. Bless you. Thank you, sir.
Thank you. Thank you, doctor. And Eid Mubarak also.
Dr. Danesh?
It's a very good presentation. Some cases were discussed, and those cases were really brilliant, even though in a short time, doctor has come out and presented such cases. That means he has immense knowledge of materia medica as well as the confidence of converting rubrics into converting symptoms into rubric. That's why he is able to make such wonderful cures with homeopathy. That's the beauty of knowledge with the science, because as we used to say that homeopathy is a science as well as an art. The artistic part is really the case taking, and once you are able to find out the real case in the patient, then definitely you will be a winner if you know the rest of the homeopathy. That means converting the symptoms into rubric, then finding the simillimum, then administering the correct dose. Dr. Harish Kumar has such a brilliant knowledge in all this respect, and he's having the confidence in himself. That's the thing. Only a person who has the confidence in himself can do such wonders, because people may think that, oh, this may not work, so I have to change the medicine, and then I have to give some other medicine, or I have to change the potency like that. Or sometimes I have to repeat all this medicine. So if the physician has the confidence in himself, definitely he will wait for the result, and naturally the result will come. This is what I have to say about all these presentations.
Thank you, doctor. Thank you.
Thank you, Dr. Danesh. What you said is correct, because selection rubric and the confidence, confidence to take the risk, because if I'll see what will happen. Dr. Ram Parvesh Shah, what do you want to say?
Thank you, Dr. Adni. Congratulations,
Thank you.
Dr. Harish Kumar, sir. Excellent session on clinical experience according to symptomological and rubric treatment. According to miasmatical treatment, role of miasmatical treatment in allergic case. There are three types of angle of treatment: symptomological treatment, first angle, and miasmatical treatment, second angle, and pathological treatment, third angle. So, role of miasmatical treatment in homeopathy kindly deals the. Thank you, excellent session, clinical experience. Thank you.
Thank you, Dr. Ram Parvesh Shah. And
As he said, actually, I just want to, if you want to cure any case, definitely miasmatic treatment or miasmatic application will only give the result. You can manage the case with so many other methods. There are many methods to manage the cases, but if you want to have that cure, then definitely. For example, psoriasis, if you want to manage, you can have so many medicines, but if you want to cure it, but otherwise, if you manage, definitely it will go away, maybe and relapse, maybe after 6 months or 1 year or 1.5 years, and it is only a relapse. That's it. You cannot call it a cure, just like that.
Okay. Thank you, Dr. Ahmad ji, Hussain ji. Eid Mubarak ho. Thank you.
Doctor, what is your success rate in treating autoimmune disease?
My
Yes.
success rate, maybe 60 to 75%. Because most of the time, the thing is that patients may not stick on. That is the main issue. Because see, honestly, you cannot boast of yourself being the superlative prescriber. But many times we may miss the point. So the thing is that in severe cases, if you miss the first prescription, it is very tough. This is my experience. And mostly the autoimmune disease cases, they come as a what you call for testing you actually, or like we will give a trial. We will go to this person also. That is the way they come. And if you miss the first prescription, if it is wrong, then it is very tough to get done. So most of the cases which I lost is all because of that first prescription got wrong and they didn't come back. Maybe if they are ready to give you 3 or 4 months, definitely we can have a good result, because that first prescription is very crucial. Because autoimmune diseases are very deep syphilitic cases. Many times you may miss the real point. Especially these days, I have missed many things.
Whether you stick on with the constitutional medicine or whether you may give some other.
Mostly constitutional medicines only, but there can be that what you call flare-ups of acute exacerbations. So at that time, maybe according to the situation, we'll give the acute prescriptions also, and if needed, may repeat a bit occasionally.
Okay.
But those cases, even one case of what you call myasthenia gravis, 1 or 2 cases was there. And in such cases, there is no that much possibility of acute exacerbation. So that is very easy. But when it comes to SLE, naturally, there can be a high chance of rheumatoid arthritis. It is not a big issue. You can manage it. Maybe occasionally acute pain may come. But SLE is something there is always high chance of going into other issues also. Those cases gives tough time.
Okay.
thank you, doctor.
While choosing the medicine for that kind of diseases, you will once you get the medicine after repetization, whether you stick on to the anti-miasmatic method in that case. So whether you apply a medicine by choosing the medicine by means of this miasmatic theory.
Honestly, actually, see, what is all about a miasmatic means a case which is thoroughly taken. All the journals and physicals are considered. Then what remedy comes up is usually a miasmatic remedy only, just to check that whether that medicine is covering that miasm is the only part that you have to do.
Exactly.
Yeah, mostly it will be syphilitic or maybe all the polycrust remedies are almost there covering all the miasms. It is my take. Okay. But what I would say about other not non-miasmatic in the sense that when you give a medicine for that, just symptomatically, if you want to handle that symptom, then you cannot claim that it is a holistic medicine or constitutional medicine. That cases you cannot claim it to be a miasmatic. Otherwise, all the medicines which is being well taken case, it is usually a miasmatic remedy. That is how I differentiate.
Thank you, Dr. Danesh. Thank you, Dr. Harish. On behalf of IFPH, thank you so much. And now we are moving to Malayalam session. Come again with your cases because the way you are presenting the cases, we can absorb easily because not much much elaborated, but even though sweet, it's like a capsule, we can digest easily. Thank you so much for taking such a classes and come again.
Thank you very much.
And we'll move to Malayalam session. I'm inviting Dr. Mariamma John for moderating Malayalam session. Please welcome.